All right, family, joined by Kathy Moore, Muskegon County Health Department Executive Director. How you doing today, Kathy?
I'm doing great, Paul. How about you?
Doing awesome, doing awesome. Things have changed since our last week conversation, and can you get us caught up?
Oh my, yes. So I think everyone knows that some additional restrictions from the state happened over the weekend, and that is relative to gatherings, high schools, um, and high school sports for 3 weeks, effective this Wednesday. All high schools in the state of Michigan must go remote. That sports are postponed for that 3 week period, and restaurants, bars are not open for in person. Inside, they can have outside patrons or clients, or they also can serve delivery or carry out.
Okay, so this is similar to what happened in April then.
Yeah, not as extensive as the stay home order, because there are still most businesses can still operate, but they're asked if their employees can work remotely to please, or basically it says if your employees can work remotely, they must work remotely.
Okay, so
Yeah.
this is mandatory. This is mandatory then.
If this is a director Gordon order, state of Michigan, Michigan Department of Health and Human Services. Yes.
Okay. So what kind of guidance can you give out to small businesses?
Small businesses, I would say, please pause, go back, look at your operations and look at where you have your staff stationed, and just review your safety measures. Make sure you are spacing out your employees. But if you have in-person services, if you have people coming into your business, just monitor the flow. And we're trying not to increase this spread. If you have the type of business where you can go to appointment only, close the doors and ask people to call and make an appointment. Explain to them that you're going to require the mask and you're going to stay social distance. If you cannot distance socially, then you may need their name and contact information. But really, this is just a pause and look at your practices. And what we're asking is that if anybody is positive, we want as few close contacts as possible.
Okay. No, I went to a restaurant last week here in Muskegon County, and they took our name and telephone number down. What was that for?
That is part of the emergency Michigan Department of Health and Human Service order, that the restaurants maintain the name and contact information of the people that go in and sit down for in person.
Now, not all the restaurants are doing this.
Probably not. That is again, it is required. But yeah.
Well, I'm not going to rat anybody out then. Well, so it's a requirement for contact tracing.
Yes.
Okay. Where are we at on numbers wise in comparison to last week?
Oh my goodness, Paul. The numbers keep going up. So we are over 4,600 as of today. There's some confirmation. We'll still be getting some weekend numbers in even later today. Um, really, really sad to report that we had 12 deaths over the weekend alone.
12?
12 in
Wow.
a weekend time period. And that's quite unfortunate. Just again, this virus seems to be a little more aggressive than it was in April, May, the April, May peaks. We have a lot of close contacts that's becoming positive cases. So we just still need to, step back, keep our social circles small, and really try to keep this thing at bay as long as we can.
What do we know about these 12 people who died over the weekend?
So for the most part, again, that they are individuals that are over the age of 70, underlying health conditions. Except I do want to say, Paul, we are now seeing cases, and I have at least four that I can recall just recently of individuals who are younger, who did not have any underlying health conditions that we're aware of. Like they weren't under a doctor's care, and we haven't been able to determine that they had a medical condition post-mortem. It could, it could be that they did and they just hadn't sought care for it. But we are seeing younger deaths, and I would almost name that young age, except it might be able to identify that individual. But we're seeing deaths younger, much younger than age 70, younger than 50 even.
So this person, can you give out the age bracket?
Yes, younger than 50. So
Younger than 50?
yes.
Well, 12 is a huge number. That probably double for where were we at prior to that?
Well, I don't know how many we have seen before over a weekend, but we are now at a 122 deaths to date. And
122 deaths.
yes,
So that's 12% happened over the weekend, one
yes,
weekend.
yes.
Okay. What can you share? What else can you share with us that we need to know?
The number of cases at the two prison systems, this was as of the weekend, and so it may have even been updated more for today. We have the EC Brooks Correctional with 1,174 tested, 429 positive. Of that 429, 407 are active. So these are recent diagnoses. And then the number of employees have grown from 13 positive last week or earlier this week when I talked to you guys last to 33. The Muskegon Correctional Facility tested 1,397. They've identified 1,107 as positive, and they only 104 as active because these positive cases were diagnosed, a month or two ago. But their number of employees are now up from 46 to 62. The inmate cases are state of Michigan cases, so they're not included in our community numbers, but the employee cases are included in our community numbers. So those are going up as well.
Are the hospitals still at capacity or close to capacity?
Absolutely. Yeah, unfortunately, yes. And so it's very difficult. The number of cases, hospitalized cases are up, record high. The number of people reporting to the emergency room for COVID-like symptoms and care, record high. And we still need to really help with our hospital capacity by, trying to stay as safe as possible, trying not to spread this to anybody, but especially those who may need severe medical attention because we have limited capacity.
We got an online question from Bridget Knox. She said, "Do you think they will close more things down like salons, gyms, etc.?"
I don't know. We're not seeing where those cases are coming directly from some of those smaller places. We are seeing a lot of responsible business owners, especially the smaller ones. And so I don't know that they'll move towards that. The what we might see right now, this is a 3-week closure. And what we might see is this extended another 3 weeks and then possibly another 3 weeks, because we want to see how the numbers go after the holiday. And then if it doesn't go in our favor, we may see an extended closure. And then after Christmas, and then we still have New Year's as well.
All right. So no visiting, no like mixing of households over one. I think I've seen that. Is that what it is?
Yep, they're asking. They're saying no more than 2 households get together, stay in cohorts. Meaning, if it's my residence and my mom's residence is just those 2, trying to limit the number of people exposed and the number of people who we have to quarantine and contact trace. They're also saying that, you make an internal pact with each other that, we're gonna stay our distance, we're gonna be as safe as possible. But if any of us in this cohort gets sick, we're gonna let each other know too, so we can stop the exposure as fast as possible.
Okay. What about testing? Are testing being ramped up, or are we probably at the max?
We have testing available. I don't think we're maxed out, but I think the appointments are getting further and further out. Like people are calling with symptoms and they'd like to get tested. Some of these appointments are 2, 3, 4 days out. I would tell people, please, call 211, get in wherever you can get in as fast as you can.
Are there any new symptoms we need to be aware of?
No, just a lot of we're seeing a lot more of the lost sense of taste, sense of smell. But I think the real concern is that, we're into flu season, we're into cold season, and some people have had mild symptoms and really kind of brushed it off as if, or thinking that it was, flu or cold or something that they get every winter.
Okay. So if you are going to have another household visit you, and what should that capacity be?
It should definitely be less than 10 or 10 or less. And,
That includes kids. That includes kids.
yeah, yes.
Everybody. Okay.
And so your own, you know your own environment, you know your own home capacity. So 10 in a household of a small house, that's still not 6 feet apart. Some people can handle the 10 and still feel like, yep, we social distance. But if you can't, we gotta do it just a little different this year until we can get this thing under control, because it is not worth anybody's life. It's not worth the life of your loved one to share that food. I'm not a cooker myself. I look forward to Thanksgiving and having other people's amazing cooking. But I'm gonna have to have a few stomach growls this time.
Right.
It's not worth it.
All right. Well, maybe next week we could talk about the vaccine. People are concerned about the vaccine. I read that it is in the 90 percentile of being effective.
Yes,
There's going to be some hesitation in the Black community about vaccines, and I'm sure you can relate to that because of the history with
yes,
our government and vaccine.
absolutely.
Um, hopefully we can talk about that in the future. Anything else you want to share before we go?
No, just everybody, please. It's still out there, and it's just really sad to report that our numbers are going up, and it is impacting our community dramatically. So please, let's try to be safe, everybody.
All right. Thank you so much for being available. Such short notice as always.
Sure.
All right. Make sure you have a good week.
Thanks, Paul. Take care.
All right, you too.